Not too long ago, getting basic medical care meant choosing between two extremes. You could wait days or even weeks for an appointment with your primary care doctor, or instead, you could walk into a hospital emergency room and walk out with a massive, punishing bill. That dynamic left a massive hole in the healthcare system for everyone caught in the middle. If you had a sinus infection, a sprained ankle, or a minor cut, there was no practical place to go. The modern urgent care center was built specifically to fill that exact void. It offered a compromise: walk right in, get treated today, and pay less than you would at the hospital. By making same-day, walk-in care widely available, these clinics commoditized healthcare access. They trained consumers to expect healthcare on demand, turning convenience into a baseline expectation. Urgent care data shows over 15,000 centers, with 670 opening in 2024. Walk-in availability drives over 200 million annual visits. But this convenience has a consequence. From 2013 to 2022, urgent care insurance claims spiked by 207%. The urgent care model solved the access problem perfectly, but by making it so easy to walk through the door, it triggered a highly expensive wave of continuous, systemic overutilization. A walk-in clinic still relies on a physical building. Patients still have to drive there, check in, and sit in a waiting room to see a provider. This cost comparison illustrates the financial friction of that model. A typical urgent care visit runs about $180. According to Fair Health data, the actual allowed amounts billed to insurance vary across regions, generally hovering between $110 and $167 per visit. Anytime a medical model requires paying for commercial real estate, front desk staff, and in-person medical teams, there is a hard floor on how much money and time it can actually save. For individuals, those costs appear as out-of-pocket copays. But for the businesses providing employee health benefits, this creates massive plan cost exposure. Millions of minor, non-emergency visits quietly stack up. A single claim doesn't sound overwhelming, but when an entire workforce uses urgent care as their default medical option, the heavy claim activities steadily drains the employer's health plan budget. There is also a structural catch keeping these numbers high. 39% of open urgent care centers are owned by or affiliated with larger health systems. They act as a highly effective entry point to capture patients and route them into more expensive hospital networks. The very clinics built to divert patients away from expensive emergency rooms are now putting tremendous strain on employer health plans through sheer, unmanaged volume. Getting those costs under control requires an entirely new approach to first contact care, 24/7 telehealth. Operogo, powered by the Paradigm platform, offers a truly frictionless alternative to the traditional physical waiting room. Instead of driving to a clinic and waiting to be seen, patients access care instantly from their phones or computers, from any location, at any hour of the day or night. This summary of the Operogo platform highlights an immediate financial benefit for the patient. The upfront fee is completely eliminated, making access free at the point of care. By stripping out the physical overhead of a brick-and-mortar building, telehealth removes the friction of getting care and dramatically lowers the cost of providing it. And the next bullet point reveals the most critical benefit for the businesses footing the bill. Under this model, there are zero chargebacks to the major medical plan, cutting off the downstream financial exposure. This turns Operogo into a clean access point. Employers can smoothly redirect non-emergency issues away from high-cost physical clinics and resolve them virtually without triggering a single health plan claim. It establishes a rare alignment of interests. Employees still receive the fast, convenient medical attention they expect without penalizing the employer for that convenience. The data proves that patients will always choose the path of least resistance. A zero-cost, virtual-first platform is the only financially sustainable way for employers to pave it.